Hi, I'm Pranayaa Jeyaraman, and this is my project on the integration of deep learning in skin lesion diagnostics. I'm currently a rising senior at Woodbridge Academy Magnet School, and I'm also a research analyst at the National Children's Hospital. There, I'm doing research on asthma and its prevalence in certain nations around the world. I'm also writing a book called The Brain's Memory, A Guide to Healthy Aging that is targeted towards the geriatric population to maintain cognitive decline. I also am a neuroscience research blogger and co-author under Dr. Charles Pigeon, who also helped me with this project. I'm also a schoolhouse SAT tutor, and I have been for the past 2 years. I'm a programs director of a New Jersey foundation called the Ohm Foundation, which raises money for pediatric research and awareness. And I'm also the president of a STEM-based nonprofit that exposes kids to the real STEM fields and professionals in the field as well. Skin cancer, a silent threat. 1/3 of all cancers that are diagnosed annually are actually skin cancer, and you have 2 times the chance of developing melanoma with 1 blistering sunburn in childhood. One of the key things I'm going to keep repeating throughout this presentation is the importance of early diagnosis. So here is a little chart of melanoma prognosis. So in localized, which is just on the skin, you have a 99% 5-year prognosis. For regional, which also means it kind of goes into the lymphatic system, it drops to 71% and then drops to 32% once it becomes metastatic. Now here's some background on cancer in general. It is actually the uncontrolled growth of abnormal cells. Negative effects include damages to organs and tissues by consuming nutrients and also placing pressure on them. This therefore interferes with the bodily functions and also has the ability to spread really easily, which is called metastasis. This is why early diagnostic research is important, so that treatment can be enabled when the tumor is still controlled. The importance of skin cancer prevention and designing a screening program in low resource settings. So I developed a web page called Clarity AI that uses deep machine learning and is able to identify what type of skin lesions they are based on the image. The reason this is so important is because skin cancer is largely preventable because it has such a strong link with UV exposure. Especially in lower resource settings, many people are working outdoors and therefore they have a lot of UV exposure. This adds on with the less awareness and access they have to sun protection and the less knowledge they have on the warning signs of these tumors. Also, limited access to healthcare leads to the inevitable later diagnosis, which means there's a higher morbidity and higher mortality, which leads to negative outcomes for the patients either way. Image processing by deep learning. Deep learning is a form of artificial intelligence that uses artificial neural networks to train computers to learn patterns and make decisions, basically allowing the computer to think on its own. The deep learning that I used was ResNet 50, which is a deep forward convolutional network, which is designed for images and extracting spatial patterns and features. This is feed forward, meaning that it does not loop, unlike other models. Here is an image of kind of how this sort of model works. And basically an image is inputted and is perceived in a 3D fashion. Then the image is broken down part by part, in this case, a 5x5 scenario, and keeps getting broken down layer by layer. And eventually the 3D image is converted into a 1D image that can be classified through the green light, red light system. So therefore, if you put an image of a squamous cell carcinoma, the computer will be able to match that with previous images of squamous cell carcinomas and identify whether or not that's the diagnosis. So the dataset I used was PAD-UFES-20 dataset, which had 2,298 clinical images, and it was from a survey and research done in Brazil. And it had a great variety in samples, including 3 types of skin cancer, basal cell carcinoma, squamous cell carcinoma, and melanoma, and also 3 benign lesions, actinic keratosis, seborrheic keratosis, and nevus, which is just a basic mole. This is the article that I got the data set from and was inspired from. So step 1, you input the patient's data. Here it's an image of a basal cell carcinoma, and you just upload the image. Then the image processing. Again, I use the model ResNet 50, which means there's 50 layers. This includes layers such as the diameter, the length, the width, the discoloration, abnormal borders, and all these sort of little aspects of the image are analyzed through this code and then are able to be matched up with a diagnosis. So the results. Here, this sample had a really high match with the cancer image data set and had a 98.81% match with a basal cell carcinoma. So therefore, you can assume that that's what the lesion is. In conclusion, skin cancer is highly prevalent in all age groups because it is such a strong link with UV. So annual visits are vital for early diagnosis to make sure that patients can have the best treatment. Deep learning techniques are amazing tools for comprehensive analysis with high accuracy, such as the resources like this Clarity AI, and which can also be provided to not only patients, but also physicians for an assistive measure alongside their expert opinion. Furthermore, clinical applications can be tested over time and be similarly applied to other diagnostic fields. This can be within oncology itself, or can also spread into other medical diagnoses. Here are references of some of the articles I used for this research. Now I'd just like to acknowledge some of people who mentored me. So Dr. Charles Pigeon was the professor who helped me a lot with this project. Dr. Anand Gaurishankar was the first person I did research with. This is the asthma project I referenced earlier at the National Children's Hospital. And Miss Bowen is my teacher from school who encouraged all of us to get involved with global health and research in general. Thank you. And here is my information for contacting. Thank you again.